I would like to call to order the September 3rd, 2024 Cabarrus County Board of Commissioners work session. Welcome, everyone. Commissioners, you have a copy of the agenda before you. Do I hear a motion to approve the agenda with the changes on page 4? And I will include one additional change to move item 5.1 up to 3.3, just because of time constraints for our person attending. Okay, we have a motion and a second. Any discussion? All in favor, please say aye. Aye. All opposed, no. That motion passes. And we move to discussion items for action. From Soil and Water, grant application to the North Carolina Agricultural Development and Farmland Preservation Trust Fund and USDA Agricultural Land Easement. And we're happy to have Daniel McClellan with us for that item. Welcome, sir.
Good afternoon. Okay, last year, same time, same month last year, I came to y'all and asked for permission to apply for these grants for state funding and federal funding for a conservation easement. We were unsuccessful last year in getting that grant. There were 100-something applications for those grants and only 22, I believe, got, and we were like 24. So we were real close. But we still got a list of people that are wanting to apply for these applications for conservation easements. And I'm asking for, permission to apply for these two grants. Actually, you're going to apply for 2 state and 2 federal grants, but you have to have the state funding before you have the federal funding. So anyway, if we could have permission to apply for those grants for applying conservation easements to farmland in the county.
Okay, and that was something you needed us to vote on tonight, correct?
Yes,
Because
sir.
of time restraints? Great. Commissioners, questions for Daniel? Okay.
You don't have to vote on it tonight. You can vote on it at your regular meeting.
Okay.
Sorry.
Okay,
Yeah.
both of your items?
Yes,
Okay,
yes,
great.
yes.
All right, very good. Okay, then you have the next item as well, 3.2.
All right, Amy's gonna.
Hi, and thank you for letting us go early. We appreciate it. Our second item is similar to the regular conservation easement program, but the State Agricultural Development and Farmland Protection Trust Fund has created a new program recently. I think this might be the 3rd year they're offering it, called Agricultural Growth Zones. It's similar to the conservation easement program, except it kind of gives the county or land trust or whoever the applying entity is a little bit more leniency and choice in choosing those conservation easements for funding. So the second item we are asking you all for is permission to apply for those agricultural growth zones. Kind of the caveat with that is it requires backing funds from the county. So there's some information about this in your agenda items, but we are requesting to use the funds from the back taxes, also known as the Ned Hudson Fund, to kind of back that for our state application. A little bit of background and a little bit of the kind of benefits of the local agricultural growth zones is that they create a buffer area in the county of agricultural land. It kind of can slow some of that, development sprawl that we're seeing, and also provide a little bit more safety and infrastructure for that farmland, having less cars on the road, that kind of thing to, make it a little bit easier for the farmers to get their equipment on the road. But like I said, part of that program is having that backing money from the county entity. We do have a proposed agricultural growth zone map here as well. We're really kind of targeting areas south of 49 as well as east of Coldwater Creek as the main priority for conservation easements in that area, and obviously excluding areas within the municipalities there. But since the Ned Hudson Fund, which was named that in 2022, was developed with the goal of supporting the local food economy and purchasing conservation easements, and that money comes from the deferred taxes on property removed from PUV. We are requesting permission to use $600,000 of that fund on our application to be matched with an additional $600,000 from the state. So, happy to answer any questions about that.
Questions on that item?
No questions, just a comment. I had read through all the information that you guys have provided, and I think it seems like an excellent idea. So
Thank you.
I'm all for it.
Great. I would agree. I think there's an excellent use of those, the Ned Hudson Fund, which for the viewing audience, that the PUV is present use value and properties that have come off of the program, and then they're required to pay back the discounted taxes for several years. And I think this is exactly the intended purpose of those funds, to preserve more land. So I would be very much in favor of it. Anybody else have a comment or question?
Just a brief comment. Now that we added extra personnel with soil and water to help us with conservation easements, it's going to probably see a lot more of these when the grants come up, because it's going to help us preserve more land in the future. And before, we had them stacked up, but we didn't have anybody to help us get the easements done. So by adding the personnel, Amy, I think that might be you.
It is.
That does the conservation easements. And $600,000 really don't go far, but the fund that we're talking about, the present use value fund, it generates probably quite a bit more than that over the course of a year or two. And so I'm all for us using that money to help preserve lands and, sort of make it a little bit better for the citizens in the county because of the buffer zones that it gives you between subdivisions and things like that. So it won't all just be one big massive subdivision. We'll have some buffer zones there with these conservation easements. So I'm all for it.
Any other comments or questions? Okay, we thank you very much.
Thank you.
Thank you.
Okay, next is item 3.3, which was moved up from the Youth Commission Suicide Awareness and Prevention Week proclamation. We're happy to have Molly Murray and guests with her for that
Yes.
presentation. Welcome.
Thank you. Tonight I brought a youth commissioner, Nihar, who will be doing the proclamation. Over the last 2 years, the youth commission has focused on mental health and wellness, and so we wanted to advocate for this to be in Cabarrus County, and so he brought this forward as a youth commissioner and advocating for it. So he is now going to present the proclamation to you all.
Proclamation, Suicide Awareness and Prevention Week, September 8th through 14th, 2024. Suicide Awareness and Prevention Week, changing the narrative, hope lives. Whereas September 10th it was established in 2003 as World Suicide Prevention Day by the International Association for Suicide Prevention, IASP, in conjunction with the World Health Organization, WHO, to draw attention to suicide as an important global public health issue. And IASP has announced its 2024 to 2026 theme as changing the narrative on suicide, to promote discourse and changing public perception of this complex issue from silence and stigma to openness, understanding, and support, while promoting systemic responses based on the notion that suicides are preventable. And whereas since 2008, September has been recognized as National Suicide Prevention Month by the SAMHSA, the CDC, and other governmental and non-governmental organizations concerned with public health and mental health in particular, as a means of focusing attention on suicide, its warning signs, and how to seek assistance. And Whereas the 988 Suicide and Crisis Lifeline became nationally available on July 16, 2022, enabling callers to connect with local crises counselors using the easy-to-remember 3-digit number 988 that people can access via phone, text, or chat. And since that time, usage of the Lifeline has dramatically increased, though many people remain unaware of this resource. And whereas suicide remains a major public health challenge, with over 1,500 North Carolinians dying by suicide annually and approximately 49,000 deaths by suicide in the United States, suicide is the 11th leading cause of death in the United States, according to the CDC, and the second leading cause of death among individuals between the ages 10 and 34. And according to the North Carolina Injury and Violence Prevention Branch, in 2022, there were 54,770 ED visits related to suicidal ideation and 14,154 ED visits related to self-inflicted injury in our state. And whereas each death by suicide directly impacts numerous family members, friends, co-workers, loved ones, and often the entire community, the vast majority of those who die by suicide have mental health issues, sometimes unrecognized and untreated. Volunteer-based organizations such as the American Foundation for Suicide Prevention, AFSP, are committed to save lives and bring hope to those whose lives are affected by suicide. And whereas Cabarrus County is committed to promoting protective factors against suicide, and suicide prevention requires a comprehensive multi-level approach that encompasses strategies for prevention, early intervention, treatment, and postvention after death has occurred. And by working collaboratively across sectors, we can create a more supportive and compassionate society where everyone feels valued and understood, and suicidal behavior becomes less likely. And whereas Cabarrus County, along with organizations such as AFSP, encourage people to recognize that deaths by suicide are preventable, that there is no single cause for suicide and no single prevention program effective for all communities, that coping with stress, safety planning, and reducing access to lethal means must be part of our routine health and behavioral care for all, and that everyone has a role to play in suicidal prevention.
Thank you very much.
Thank you.
Commissioners, as you heard, the dates of Suicide Prevention Week are next week, so there's been a request for us to suspend our rules and vote on this tonight. So does anybody have any questions or comments prior to that? If not, I would entertain a motion to suspend the rules so we could take action tonight. Okay, we have a motion and a second. Is there discussion? All in favor, please say aye. Aye. All opposed, no. That motion passes. And that I would now entertain a motion that this board adopt Suicide Awareness and Prevention Week proclamation as presented. Okay, we have a motion and a second. Any discussion? I would just say applaud the Youth Commission for taking on mental health. Yes.
Thank you.
This is very much in line with some of the priorities that Cabarrus County is undertaking. Certainly amongst those are the behavioral health facility that we're in the process of trying to get built, and this falls very much in line, and the facts that you reveal through your proclamation, I think, go a long way to create public awareness of just what a big problem this is. So thank you.
Thank you
Any
all for your
other-
time.
Yeah, thank
Yes,
you guys.
any other comments?
Would you like to come up here and take a picture from the front? Because you recorded the whole thing, but you only got the backside, so would you like to come up here and, while he's sitting, get
You
your
can sit
picture?
your deck and go there.
Yeah, yeah, and that way you can get one from where he's actually at.
Yeah, and while he's doing that, shall we vote? All in favor, please say aye. Aye. All opposed, no. That passes unanimously. You go right ahead.
Thank you.
Thank you all.
Thank you. Okay, now we move to discussion items for no action, and we are delighted to have with us Asha Rodriguez from Atrium to talk about an exciting project that she and others are proposing about blue zones. Welcome.
Thank you. And I apologize, you'll have to let me know how much time I have to present, as well as how you'd like me to walk through the slides that I have here.
Well, so far, there's no limit,
Okay.
but that could change.
I'll try to keep it nice and tight, and I'd like to, well, first of all, thank you again for welcoming me here tonight. My name is Asha Rodriguez. I lead Atrium Health Cabarrus, formerly as the facility executive. I've been here for 6 years, 5 years in the role, and thankful for the county commissioner's support. I'd like to introduce a special guest who's on the line, Dan Buettner. Dan, if you want to turn your camera on. Dan Buettner is the son of the researcher and founder of Blue Zones. If you haven't seen the documentary Living to 100 on Netflix, it's a precursor to some of the work that we'd like to be able to do here in Cabarrus County. Dan, I'll turn it over to you so you can introduce yourself.
Yes, my pleasure. Hello, everybody. Dan Buettner Jr., Chief Development Officer. A lot of people call me Dan Buettner 2.0, so you feel free to do that. And it's a privilege to join Asha today. It's been remarkable to work with the Cabarrus Health Alliance and Atrium Health over the past year, and excited about what Asha is going to share here today.
Thank you, Dan. All right, I'll jump right into it. We started first with, and I really want to share this. We're talking about aging and older adults. That's primarily the target, but this is a for-all initiative. It has the opportunity to really boost our entire community. So you may be asking, why now? Well, first of all, our top 3 causes of death in the county are Alzheimer's, dementia, cardiac, and cancer. And secondly, as you guys can see this, we have the honor of having significantly aging population. I would say 50 and better. We will beat the North Carolina statistics, as you guys see here. In some cases, that 60 plus will double. So that's a testament to our community. However, what I will share with you is there's going to be some serious impact when it comes to functionality, limitations, and frailty, but also more demand for support services and folks who want to be able to age at home but may not be able to if they have mobility challenges as well as poor health. We also have, what most people don't realize is that Atrium Health Cabarrus, we have the largest volume of Medicare discharges, as well as the largest volume of geriatric patients in our ED out of the greater Charlotte market. So again, we have the blessing of having an aging population, but with that will come some significant challenges, and we're already starting to see that with the lack of post-acute support in our community, to include additional SNFs, long-term care, and the like. So I do want to share this with you because there's been a lot of intentionality in the last 5 years, 6 to 7 years actually. We started a transition clinic that was grant funded that helped us with chronically ill patients. We also began the first of its kind lifestyle medicine clinic at home. Atrium has not seen that before, and it is, some of you may know Dr. Andrew Nance. This is his life's work and calling, and he spends quite a bit of time actually out in the community doing at-home visits as a family medicine provider. Just tremendous amount of work being done there. During the pandemic, we noticed very early on the largest population of our patients who were really struck incredibly ill and had the largest mortality was in our greater than 65 patient population. We had to take a step back and ask ourselves, if this is going to continue, how do we best serve this population? So we sent one of our directors off to a age-friendly fellowship for the Institute for Health Improvement. He came back, and I give him credit here. Barbie, you should let him know that I call his name. His name is Trip Grooms. He's no longer with us at Atrium. He's gone off to do amazing things someplace else. But he came back with a model. It's called the 4 M's. And we took that and developed a pilot on one of our units. 4 M's are key to age-friendly care, and they stand for mobility, mentation, what matters to the patient, as well as medications. We built a program around that, started with one of our patient units, made it an age-friendly unit, and from there we've since expanded that unit, so we now have 60 age-friendly beds in the hospital with very exceptional outcomes, about a reduction in 50% in falls, lots of medication changes, and a length of stay reduction for those patients because they're no longer confused and able to get home in a much more timely fashion. We have also begun what I refer to as a journey in our emergency rooms. Our main ED is now bronze geriatric ED accredited. We are moving forward and have submitted an application to become silver designated, and our 2 freestanding EDs have their application submitted to become a bronze designated ED. We have some collaborations on the horizon, one with Atrium Health Wake Forest to become a base of operations for their School of Geriatric Medicine, their J. Paul Center on Aging and Rehabilitation, and we are working with Premier on a collaborative to do some research on Alzheimer's and dementia that hopefully will bring research trials right here into Cabarrus County, which is something that's quite unique. When you think about it, there's a lot of opportunities across the country, but usually in small pockets where folks can receive trial medication, and we'd love to be able to bring that here. And with that being said, the next version of this is, you guys can see, we've done a lot on what I would refer to as the acute care side at the hospital. Is what do we do outside of the hospital, outside of the four walls? How do we help to support well-being at a much larger scale? So enter Blue Zones. Here is a photo of that. Dan, I'm going to get this wrong, but it's really, you go to Netflix, you look up Living to 100, and you're going to see this here. The second on the right is a book that we've been using it for our age-friendly steering committee, and we have been for the last 5 years. So I like to think of this as full-on manifestation that we were able to meet last year and work with you guys. But our team, our entire age-friendly steering committee, reads this book and looks at the opportunities for us to replicate some of the secret sauce, if you will, with our patients, and we've been really successful with it so far. Dan, I'm going to turn this slide over to you. You're probably going to do this way better than I.
Yeah, building on 25 years of research of the world's longest lived communities and peoples, what are the best practices from our species? Blue Zones, the company, has had the privilege of partnering with American cities to operationalize this, to shift environments that support healthier behaviors, which is the holy grail of public health. And our mission is to empower people. So we don't do this to communities. When a community like Cabarrus reaches out with the Health Alliance, with Atrium, with all the ingredients there, we see a recipe for success, and to come in and partner and empower is our mission.
All right, so I'll go back here, skipping ahead, apologize. So what is Blue Zones? I've been very, very impressed by what is referred to as the Power 9. Power 9, those 9 principles that you see there in the very center of this slide, track directly to 9 out of the 15 risk factors for Alzheimer's and dementia and proves to solve them. So that's a really unique opportunity to partner with evidence-based practice. That's what I would refer to as Blue Zones in being able to address Alzheimer's and dementia. We're currently in the very first phase of this process. We are in the Blue Zones Ignite phase. Some of you in the room may, and we'd love to be able to invite everyone who'd be interested in coming to the keynote, but we've got a series of events coming up the week of September the 23rd, and there'll be cross-sectional collaboration and an opportunity to bring together subject matter experts across public, private, sector, so that we can have a conversation around what's happening in our community. Blue Zones during that time does a full-on assessment, comes back to us and says, here's what we think. Let me tell you where you guys are ready for an engagement like this, or where there may be some opportunities. In addition to that, highlighting some opportunities for improvement, but as well as what we would consider they would consider to be best practices. And the concept is really quite simple. I continue to hear this in my head over and over again, which is, how do we create environments for people to make the best choice for themselves? And a huge part of that is around people, process, and places. Am I getting that right, Dan?
People, places, and policy.
And policy, okay. And a huge part of that is schools, of course, work sites, healthcare organizations. In addition to that would be what was referred to as the built environment. What do we have here? So Dan, I'll let you take it from here, because this is your area of expertise.
From studying the longest lived populations on Earth, it's anthropology, it's epidemiology. What we know is this: health, connection, purpose, longevity, all those things are not things that the longest lived people pursued. They're things that ensued as a byproduct of where you live and who you spend life with. Individual discipline is a muscle. and muscles fatigued, you're a firefighter or a single mother or a teacher, there's too much going on. And that's not the lesson of the Blue Zones. The lesson of the Blue Zones is set up your environment, you shape your environment, and your environment will shape you. And so we partner with communities that are already on their own journey of self-determination around health for this generation and the next. And we put forward a blueprint that that looks to get a silver buckshot, critical mass of people, places, so that's schools, faith-based, restaurants, grocery stores, employers, and then policy, built environment, food system policy. And if you get enough permanent and semi-permanent nudges there, which you can do in a couple years, you see behaviors start to shift to reflect the easy choice being the healthy choice. So that's the life radius model. Take the onus off the individual and complement self-discipline and great health care with a great environment.
Thank you. There's a few more slides that'll make it easier to read for the folks who are in the back, so I apologize. You were probably trying to get in on that a little bit sooner. But these are the blue zones that Dan Buettner was able to identify. The really impressive thing across this is that regardless of the geography, you can see this in multiple continents, and regardless of socioeconomic status, he was able to find populations that still were able to make the right choice, or the easy choice, the right choice, given their circumstances and their built environment. So the real goal is to take the research from those places and be able to infuse them into a model or the blueprint like Danny described. Here's the Power 9 a little bit closer here. The first of which is move naturally, having a purpose, or ikigai is what it's referred to. Downshifting, reducing chronic stress. The 80% rule, which is about eating when you're at 80% full, being more plant slant. Much less meat is consumed in the diet. I think it's a 90% plant-based, 10% maybe meat or fish. Wine at 5. Or meat, I'm sorry, animal products, wine at 5. I don't know, Danny, I'm still, that's what I'm still struggling with. But you say so, a little wine every day according to that is helpful.
It's 4:30 now.
The right tribe, or refers to as something called moais, which is people who come together at common purpose, caring for each other. One of the things that I find is really exciting about that for our community is, unfortunately, much of our community is aging alone. And so if Blue Zones is able to help create, it will feel somewhat artificial, it's not an extended family, but sign people up into moais. I think the research has shown that some of these people continue to walk together and care for each other for many years thereafter. And then finally, loved ones first. How do we create family support, purpose, all in those spaces, and where they belong, and that sense of belonging. And you guys know we want people to live, work, and play here in Cabarrus County. So how do we continue to create ties to that here locally? Oops. Here's a little bit of an example. Danny talked about that right environment. I failed to say this earlier, but the focus is about life radius. Most people do all of their things within a 20-mile life radius. So how do we create in that environment, setting up the easy choice to be the right choice? And Danny, do you want to share anything else here?
This is really high-level healthcare strategy. It's not an accident that doing this across the country, across 90 cities, over 10 million Americans, that there's always incredible leadership, both municipal, county, and healthcare. You can have the best clinical care in the Charlotte MSA at Atrium Health, but you're never going to get the great outcomes that your modeling projects and that your mission demands if you're discharging people back into environments that are not going to make things easier for them to make healthier choices. Otherwise, you're just getting episodic care instead of a longitudinal epidemiological effect. So that's really the high-level aim of partnering with communities to go do this life radius model, get a critical mass of people, places, and policy.
Thank you, Danny. talked about the life radius for just a minute. You guys can see here, we talk a lot about this actually. We use what the concept called the Pareto in healthcare, which is 80% of spend in healthcare comes from 20% of our population, or the resources that are expended. And it kind of lines up, if you see here, which is, you guys say it a little bit differently, that only 20% of your genetics actually impacts your health. The rest of it is on your environment, the healthy behaviors, and your access to care. And so this is a unique opportunity for us to all come together and be able to partner, to be able to solve for that Blue Zones focus, as you see here. I think we're working on the access to care pieces, us as well as other healthcare providers in our community. Some people will continue to be predispositioned based on genetics, but we have an opportunity to create spaces to create opportunities, with places, policy, and people to address environmental healthy behaviors. This highlights some of these things that are here as opportunities. I think Danny walked through these. Any questions before I move on from this slide? Because I think this is a really important slide, has a lot of impact.
I think we're good.
We're tracking along. The good news is that they've done this, you guys can see all of the places where they've done work across the country. If they come to us here in Cabarrus County, we would be the single largest well-being demonstration project in the state of North Carolina. Now, they have some engagements, but they certainly wouldn't be at the level that they would do that with us here. And part of that is because when we met with Danny, our conversation was we couldn't just choose a particular city or municipality within Cabarrus County. If we were going to do this, our desire would be that we would do this across the entire Cabarrus County footprint so we could really see impact. So here are some outcomes, and I think this is really impressive. They've done some things with small communities, large communities. You all can see some of it in the documentary. But what's really impressive is the greater than 5% sustained improvement in well-being in all of those communities. That's 5%. Sometimes in your mind doesn't seem like much, but that's a very, very, very impressive number. If you're going to create improvements, and for it to be sustained says quite a bit. I've not heard of many medical interventions or health interventions that could generate those types of outcomes. So our partners, our hope is that we can financially partner with the Cabarrus Health Alliance at a much smaller scale. We at Atrium Health Cabarrus have, I'm not going to share with you what we've done around this, but we have certainly covered the cost of the initial assessment and exploring how we can fund. Our hope is to fund a third of the overall engagement. That way we can certainly demonstrate our willingness to participate, but our desire to really put this moving forward as a well-being initiative for the community. We are exploring additional partners to bring to the table, and this is where Blue Zones will be able to help us. There's an opportunity for us to engage some other community foundations as well as potential payers, because there's some reduction in poor health outcomes because of it. And then we do have a core work group. We have been meeting for the last 3 or 4 months, preparing for what we refer to as that assessment kickoff. We just had a call before I walked in here today, and we're tracking really nicely to that. Some of you, like I said, again, multiple engagements over a course of about 3 or 4 days, the week of September 23rd. And we have been very intentional in selecting subject matter experts from across the entire county, both civic and civic, faith organizations, work sites, food systems leaders, and the list goes on and on. We do have key stakeholders. We see you all as a very key stakeholder in this level of engagement. We see the Health Alliance is the same, we see the Chamber is the same, and we see both the City of Concord and City of Kannapolis as very important. Now, that's not all of our key stakeholders, but certainly wanted to engage you all before we got any further down the road. So if you had questions and this was coming up, we could respond to them for you and keep you formally in the loop as we move forward. So with that being said, we are in the 6-month community assessment phase. By November, we'll be able to do a readout. And with community stakeholders, I'd imagine I'd love to be able to come back to this group to be able to share or have you all participate if you are interested in the formal readout as we close out. If we choose to to take those recommendations and move forward with a proposal to become a Blue Zones community. It is a multi-year engagement, and Danny referenced it before. There's nothing that they do to us, but they do guide us along the process. It is a train-the-trainer program with the hope that when they leave, we would have a system and a process here that would continue to promulgate the work and perpetuate it for years to come. And so, again, the hope would be to execute on strategic initiatives that are there. So this is, we're still in the community, we're about to kick off the community assessment phase of this work, but wanted to keep you abreast of where we are in the process. And I'll stop there and take any questions you might have.
Question for Asha.
Not a question, but just a comment. As someone who's on the polar opposite side of this for a living, it's interesting in the connect. I think it was the Blue Connect phase. It talked about belonging, loved ones first, and the right tribe. And if you're around it every day like I am, you'll never convince me that people don't pass away from a broken heart, from not belonging. Somebody that's been married for 50 years, now they have no one else to turn to, no other family members. So I'm excited to learn more about it because I think that is a very important function of the community. You have to have people to lean on and to love on. And so I see that every day, that the result of not having this. So I appreciate what you're trying to do, and I'm excited to learn about it.
Thank you.
Even though it directly affects
Your business.
yeah, what I do for a living. So,
Yeah. Well, let's hope that as people transpire, they do so with a full heart and having lived a very full life. Yeah.
I got a question or a comment,
Yes,
maybe.
sir.
I see, Atrium, or right now, is providing most of the cost. So at what point would Cabarrus County, when would we know what it's going to cost us?
Danny, I think once
during
we
the
finish the
process?
readout of the process, and I want to be clear in saying our hope is that people would be, we are not requiring anyone to fund this, but we are hopeful that if you all see the value in this, you'd be interested in participating financially. And so, Danny, that would probably be around November, December.
Yes, yep, that's right.
I think what's important for us is that there's full participation, meaning that we get your input, we have your buy-in, that you have an opportunity to hear from Blue Zones, and that if you all feel compelled by the recommendations, that you all make a decision to support that as county commissioner. And I think that would be really impactful for us.
No questions, but just a couple comments. In my role on the board of the Cabarrus Health Alliance, I've heard Asha talk about this for several months, and recently saw this same presentation. I immediately went home and looked up the Netflix series and watched all the episodes in one evening because it was very engaging and very interesting. To see their discoveries in these other areas was quite interesting. I haven't quite yet committed to taking all the furniture out of my house, but I thought that was extremely interesting. In one of the communities, the elderly people had much greater mobility because they sat on the floor and they were accustomed to getting up and down throughout their entire lives. I mean, and there are a lot of other factors in there, and it's quite interesting to see how those factors are different from community to community and the things that play into that. But I think it's very exciting that Cabarrus County has the opportunity to participate in this effort. As you very appropriately pointed out, an investment and even knowledge into this type of program can result in tremendous savings on the backside, both for the individuals as well as the healthcare organizations and all the other funding mechanisms that come into play, insurance and otherwise. Plus, so you're saving money, but you're making the quality of people's lives much better. The pieces about the tribes and about family all resonate to be so true, and you know, I think just to create an awareness for people. You know, I look at Myra and Londa and the folks that are involved in our active living and parks organization and our active living centers. I think that's a lot of what that's about, and I have had an opportunity to observe a lot of our citizens that are active in those programs, and they are energetic and healthy and happy, and they have that tribe mentality in their socializing with one another. So, you know, I'm really, really excited to learn more about it.
Yeah.
I took some time over this past weekend to explain to my grandson how I would be living to 100 years plus. I'm not sure if he bought it or not, but that's certainly the best intention. But, you know, thank you very much
You're very
for
welcome.
being willing to be here to talk to us about it, and also to spearhead bringing this program to our community. And
Absolutely.
I'm really anxious to learn more.
And like I said, there's a ton of events that week. We're going to try not to overwhelm you all, but if you have an interest, we certainly will send you all an invite to the keynote. Dan Senior will, is that the, should I say Dan 1.0? Dan 1.0 will be here to speak, and I think you'll get an opportunity to hear directly from him, who's the researcher. But there are a couple of other presentations, and so there, if you all are interested, certainly we have a Blue Zones value presentation where they talk about the return on investment as well as some of the health outcomes that have come from some of these cities. So I'm happy to send that invite off. I'll allow you guys to take some time to think about it, but I'll certainly send it to the county commissioners, and you are welcome to attend. The one other thing I would say is the Blue Zones team will be doing a windshield tour of Cabarrus County, so we will take them throughout the county so they can do an assessment on our food systems, as well as grocery stores, neighborhoods, walkability, other things like that, so they get a flavor of what it's like, in addition to learning about the rich history of Cabarrus County. And I think I continue to tell Dan all the time, this is one of the few communities I have worked in where people are interested in being so engaged and caring for their own. And I think that will make it so much easier if we choose to move ahead and do this work. We already have such great things happening. The goal would be to tie together all of these amazing things with some of the best practices that that team has, so we can continue to accelerate the work that we're doing. Thank you.
Great. Thank you.
If we wanted to read that book before all these meetings, where's that book
You can
available
go,
at?
I will personally get you several copies, so
Okay.
I'll work on that this week.
Great.
Thank you.
Thank you. Okay, next up, item 4.2. We're happy to hear about the Water and Sewer Authority of Cabarrus County's master plan, and we're happy to have Chad Von Cannon here for that presentation, and several associates.
Good afternoon. I'm not Chad Von Cannon, but he is here with us today. I'm Thomas Hahn. I'm the engineering director with WASAC. Chad is our executive director. He is also here. And we have Lee Campbell, our project manager with Black and Veatch. We are happy to be here this evening. We are appreciative of the time and opportunity to present this work. This has been a key effort for us in projecting towards the future, working collaboratively with stakeholders in Cabarrus County to develop projections, see what's coming down the road, that sort of thing, as it relates to water and sewer demand and water and sewer infrastructure. This is one part and a key part of our overall set of efforts. However, we are also proceeding with some other things. We'll talk about those a little bit and have time for questions later. but we are proceeding with conceptual design with further wastewater treatment expansion as well. So I'll turn it over to Lee. Lee will have the presentation, and we're all here for any questions you might have.
Thank you, Thomas, and thank you, commissioners, for having me. Glad to be here and to talk just a little bit more about the master plan effort that we've been working on for, gosh, I think we're going on 2.5 years now. So there's been a lot of work going into this, and I'm going to try to condense that into a much, much shorter presentation. If we, as Thomas said, we get to the end, or if along the way, if you've got questions, feel free to speak up. Do we have control of the slides here? Okay. Okay, so when we got started with the project, we met with the WASAC team, with Thomas and Chad and others, to talk about what their goals were coming out of the water and sewer master plan. So on the left there, you'll see 4 objectives that really came to the surface from our conversations. First was a forward-looking master plan to stay ahead of system capacity limitations. We know that Cabarrus County is a fast-growing county, so staying ahead of that growth was very important to WASAC. Preparing for increased discharge permit limits. So basically that's getting permits to increase the capacity of the Rocky River Regional Wastewater Plant beyond the 34 MGD that is underway at this time. A prioritization of our recommended improvements. So WASAC can plan accordingly over time, over the next 20 plus years as to when and where they will need to spend the money. And then taking all this information and pulling it into decision-making tools, which is essentially some dashboards that make this more of a living document that can be updated as new information comes in. So taking those objectives, we broke the project down into 6 major tasks, and those are shown on the right-hand side of the graphic. The first one, the existing system evaluation, we won't talk about that one as much during this presentation, but it was essentially looking at what's in the system today in flows going through the sewer pipes and to the plants. Task 2, future growth planning, was an exhaustive effort, and we'll talk more about this, but working with all of the stakeholders and member jurisdictions that contribute to the WASAC system to understand what development was coming, where they could see development in the future. So multiple meetings with all of those entities. Task 3 was the Rocky River Regional MPDES permitting, so getting that permit to be able to discharge beyond the 34 MGD that's permitted today. Task 4 was water resources analysis, so looking at what water supplies are available today and as the population grows, what may be needed. Task 5 was the system capacity assessments, so looking at the system today with the growth that we're estimating from Task 2 and understanding where future projects may be needed. And then Task 6 is the culmination of those projects, pulling them together, prioritizing them, timing them, and ultimately pulling together the dashboards, which are the decision-making tools. All right, there we go. So task 2, the future growth planning, is kind of the first task that we'll talk about. Big picture here is there's just a lot of work and a lot of input from each of the member jurisdictions and stakeholders that allowed us to plan for growth, and not just growth throughout Cabarrus County, but growth to the parcel level in Cabarrus County. So we understand and able to plan exactly where we expect that growth to happen spatially, so that we can understand where flows would be tributary and make the right system recommendations, beyond just the plant where everything collects. So to do this, we looked first at land supply, looking really at what is already on the books, as maybe a developer has come in with applications and whatnot. What are we expecting currently? Then looking at what land is vacant, that doesn't already have plans. Looking at the land use, how is it zoned? Where is it in relation to existing infrastructure, both the water and sewer infrastructure, roadway infrastructure, things of that nature. Some of that falls under the suitability analysis as well, understanding, the middle of a residential neighborhood's not going to suddenly become a commercial development type thing, and understanding also environmental factors such as, streams, wetlands, brownfield sites, anything that could limit that development. And then taking all of that information and looking at growth forecast. So we're looking at how many dwelling units and jobs are expected to come to Cabarrus County over the next 20-plus years. All of this information was put into the Community Viz model, which is a Campo software from the state, and that is what was used to help spit out the numbers. Let's see, well, next slide here. This primary purpose of this slide is just to reiterate the amount of work that was done with the member jurisdictions and the stakeholders. Difference in terminology there is there were some stakeholders that are not necessarily member jurisdictions, thinking of like Charlotte Water that has flows tributary through some of the WASAC system. But we started back in, like I said, 2.5 years ago, May of 2022, we had a kickoff meeting with all of the stakeholders collectively. About a month later, we started having individual meetings, mostly with like the planning departments for each of these stakeholders. Then they went to work compiling their pending developments and really taking a look at their plans and getting back with us, feeding us data to go into the model. And then we were finally able to finalize the growth models last year at this time. The projections ended up adding numbers I have here, 27,494 dwelling units and 11,266 jobs by year 2050. Okay, so once we looked at the growth that was expected, both residential and commercial growth, we had to convert that to how does that impact the water and sewer systems. So for water, the chart that you see here is straight out of the master plan report and essentially shows what we expect the water usage to be on the right-hand columns in years 2030, 2040, and 2050. So the future annual demand is predicted to be 48 million gallons per day by year 2050. So I think for today, we're a little over 20 MGD, and a lot of that growth is really expected to be between now and year 2030. You can see at year 2030, we're predicting 35.46 million gallons a day. So we did kind of front load some of the projections in an effort to be a little more conservative, and we did not want, we want the projections to drive the improvements. We don't want any development to be held up by improvements that would be recommended from this report. Similar to the water, the chart that you have in front of you here is the sewer forecast. So as we've mentioned, the phase 3, known as the phase 3 expansion, is about to come online. I think Thomas mentioned the ribbon cutting, he mentioned to me, is next month. That will take that capacity up to 26 and a half?
That's
To 30, I'm sorry, yeah, it's 26 and a half today. It goes to 30 MGD in October. And then the project to take the plant to 34 MGD is underway and expected to come on in 2027, and we'll hit that on a future or upcoming slide. But you can see the expected flows here. 2030 is 29 MGD, 2040, 35.27 MGD, and 2050 is 40.86 MGD. This is cumulative. Rocky River is expected to be a little over 40, and then Muddy Creek is expected to be a little under 1 MGD, looking out to year 2050. Okay, so the graphic that we have in front of us here, this is for the Rocky River Regional Wastewater Treatment Plant, and I know there's a lot of lines kind of on this graphic. The blue line up top with the numbers pointing to it represents the capacity of the plant itself. So as you can see there, year 2024, phase 3 comes online, capacity goes to 30 MGD. Phase 4 showing in 2027, 34. Phase 5, we're showing 40 MGD, and phase 6, 50 MGD. Those are not set in stone at this point, but that's what we're showing currently. The two lines that parallel that blue line, so the kind of the reddish orange dashed line represents 90% of the capacity, and the gray line under that represents 80% of the plant capacity. Where those numbers come in is the state of North Carolina, DEQ, says that once you reach 80% of your plant's capacity, you should be planning for an expansion. And if you reach 90% of capacity, you should have an expansion under construction. And if you're not doing those things, that's when moratoriums and whatnot can be set in on you. So the diagonal line there shows the expected growth over time, and you can see basically, we're not in any danger if this plan is followed. You'll be ahead of the curve, so to speak, in your planning and your construction efforts. Similar graphic here for the Muddy Creek, the much smaller wastewater treatment plant. Shows the project expansion going to 0.6 MGD in year 2027 and 1 MGD out toward 2040. And again, staying ahead of the curve, so to speak, here, so that there's no limitation on development. Okay, so the fourth task was the water resources analysis. So as part of this task, basically we're looking at what are the water sources that you have available providing water, and is it enough? There's a couple of terms here. One is safe yield. Safe yield being how much water you can withdraw from your sources during a drought event. And then the operational yield would be the yield that may be constrained by infrastructure. So intake sizes, pipe sizes, pump sizes, things of that nature. So if you hear me referring to those two, safe yield and operational yield. So the safe yield, a little more definition here. The 50-year safe yield is a conservative estimate of water supply available in defined drought conditions. And basically 2008 drought represented the 50-year drought for Cabarrus County. Part of the work that went into this that we wanted to look at is exactly how much volume of water we have in the reservoir. So the little yellow boat there was a tool used to conduct bathymetric surveys, and that's a fancy term for basically looking at the storage volume by looking at how deep the reservoirs are in different locations throughout. The surprising thing was the 2022 survey resulted in an actual increase in storage from the previous one done in 2002. Sometimes you would expect that, maybe some siltation and things had happened, but we think what happened is we just had much better and more accurate data now than the tools that were available back then. So just summarizing here, Lake Fisher survey's results, they actually matched, but the Lake Howell one was the one that that primarily went up. And you see there at the bottom, the net storage increased 329 million gallons from 2002, according to our work. Okay, so another graph here. So the green square kind of on the bottom there represents the 50-year operational yield, and then the little purple above it, there was a project completed during our work that was to rehab the Second Creek intake, which is complete. So that increased that operational yield by a few gallons. I think it was 100,000 gallons a day or so.
No, that's actually 2.5 million.
2.5, I'm sorry,
Right,
yeah,
right.
sorry. And then so the other lines here, so the green line at the top represents the 50-year safe yield, and then the two lines parallel, the dark blue and the light blue, are the average annual demands. So the lighter blue that's lower represents your a 15% reduction in demand, basically as a result of if you're calling for like water conservation measures. So in a drought condition, you would expect about a 15% drop in total water usage from restrictions that may be put out there. So what this shows, again, that 80% safe, 50-year safe yield, when you cross that line, you should be planning again. So we show that, in drought conditions, you're safe below that until 2030-ish with the Second Creek intake. Let's see, yeah, 2030. And I'm going to show you in a minute how we're going to bridge that gap between the two. Let's see. Yeah, so the timing of water supply needs, I was getting ahead of myself on the slides here. So in 2028, the average demand exceeds the 50-year operational yield. In 2029, DEQ guidelines to begin the planning. In 2042, the average demand exceeds the 50-year safe yield. Now, again, there could be, if in a drought situation, you could put the lower impact protocols in place to reduce that sum. So to bridge that gap, there are interbasin transfers available from the Yadkin and the Catawba basins that essentially make up that gap. And as you can see here, what we're showing is under drought conditions and behaviors, the supply you have is good through year 2050 at least, and would continue a little bit beyond that. So then we get into the CIP development, which was the actual recommendations and prioritization and the dashboards. So through year 2050, most of the projects that we identified were capacity-driven projects. As you can see here, we had 21 projects that totaled $247 million. 14 of those were gravity sewer projects, 3 force main projects, and 4 pump station capacity increases. The majority of the cost comes through the wastewater treatment plant expansion projects, which is, you see there, a little under $1 billion, $930 million. And then condition-driven projects at the plants were very minor in the grand scheme of things. We had, a few different things that are not being covered under the current expansion plans, and those items totaled about $11 million. And then the dashboard tools was kind of the final thing that we developed here. When we developed 3 dashboards that WASAC will be able to use to help them actively manage the system and the flows and whatnot. There's a jurisdictional flow monitoring dashboard to monitor flows and compare that to the obligated flows to developers. Then there's an ICIP dashboard that is basically a little dashboard for each individual project that they can track the timing and whatnot on. They'll receive data from member jurisdictions and input that data twice a year, I believe is the plan, to keep this kind of up to date. So this is kind of the living part of the CIP project. The next 3 screenshots are just screenshots of individual dashboards. The first one is the obligated flows dashboard. Between this one and the flow monitoring dashboard, you can track, or WASAC can track, the historical flows and the developer-controlled flows in the system. There's going to be detail about locations of projects, number of houses or customers that are tied to a development. On the right-hand side is a summary of totals for housing units throughout the system. And this one is looking at obligated flows only. And then the flow monitoring dashboard will show flows down to like sub-basin level and allow WASAC to monitor available system capacity versus the capacity with the obligated flows. It'll track estimated peak flows and flow capacity for each individual interceptors. And there was a fair amount of work and back and forth, with meters and meter data and different things, peaking factors to finalize this dashboard. And then the final one is just the individual projects. So each project that we identified would have a dashboard like this that gives what the estimated project cost was, a project description on the right-hand side, and what the project trigger was. So, what's happening in the system, is there a certain flow through that line or whatever to trigger the need for that particular project. And so at this point, we have delivered the final master plan and dashboards to WASAC in their possession, and we're going around and giving this similar presentation to the different member jurisdictions. I think to date we've presented to the WASAC board and we've presented to the Concord board, and now you guys. few more steps. The task that lags behind is the permitting for the expansion beyond the 34 MGD. A lot of that is related to DEQ and their availability to review these exhaustive documents. I mean, we had to model all 90 miles of Rocky River, and that's a model that'll be used not only by Wasac, but by other wastewater plants that are tributary to the river. And so all of that's being reviewed. It's a pretty exhaustive effort with the state. So that's probably going to be going on for another year plus before we actually have that discharge permit in hand, and we're somewhat at the state's mercy. We're expecting feedback from them any day is what I keep hearing on our most recent memo. And then we've got to go through an engineering alternatives analysis, for what the options are for expanding the plant. Complete the environmental document that shows what the impacts will be to the environment. And then, once we get approval of those, we'll be ready to actually submit the discharge application. So that's it. I know that's a lot, in a short time. But Thomas and I are available for questions if anybody has any.
Just want to make sure that we heard it. So you've presented this to Concord and to us. So you're going to plan on hitting Mount Pleasant, Harrisburg, Midland? You're going to present this to everybody that's
Yes, sir,
involved?
we're working through, and we're planning to present it to all those folks, yes.
So what's the future of water supply? Interbasin transfers, they seem to be getting harder.
I think yours
more
are
difficult process.
in place.
Yes,
Some of that.
there are some pieces in place relative to Cabarrus County that make that maybe a little bit more straightforward than in other areas it might be. I believe the options that Lee presented, there's the initial groundwork laid for each of those pieces to meet those demand lines. So each of those blocks there, that groundwork is either in place or is moving forward actively. I think relative to Cabarrus County, those pieces seem to be in place through the 2050 planning horizon, or moving towards that.
I guess that would be my question along those same lines. The plans and the models that you've shown, if the projections are accurate, and I'm assuming your crystal ball is clear, then, so we know what the sewer needs are gonna be, we know what the water needs are gonna be, and so, but, and of course, who can predict what the state might do at any point in time, but do we feel comfortable that the discharge permit request from the wastewater treatment plant are within reason, that should be reasonably approved?
We feel like they are, yes, and our consultant we had a sub-consultant that worked on the modeling of Rocky River, et cetera, and they do a lot of these applications and whatnot and spec limits requests, and they felt that it was reasonable. And we're making requests to go for 40 and 50 MGD, but it doesn't mean we're tied to those. Like if we determined that 35 MGD and 45 MGD were the right plan expansions, we could do that. But yes, we're reasonably confident that we'll be able to get these discharge
Yeah, and I
permits.
guess along the same lines on the water side, do we already have the permits for the interbasin transfers to cover the projections that are shown here?
Sure, that's largely a Concord and Kannapolis question. They are the holders of those, but we understand that they are making progress towards each of those pieces.
Right. So I know that when interbasin transfer was granted a number of years ago, and I guess it's probably been almost 20 years ago now, it was a very, very controversial issue. I still hear stories from people that were on the bus to Valdez and the public meeting that occurred there. So do we have to go through that process again, or we already jumped that hurdle?
I think it's safe to say no one in this room will probably have to go through that process
Well,
again.
now, I was gonna say that earlier. I was gonna say, you're talking about 2050, 25
Correct.
years out.
Yes.
But
So
with our blue zone work, we might be.
we might. I think the most important note to note is that we have the interbasin transfer permits are in hand. There's permits to install the infrastructure to utilize those, to build the infrastructure, to make those connections or that intake or different things. That still would have to be worked out by Concord Kannapolis to get that water here in some instances. But I think what the study showed was that there's ample supply to get us through 2050. But as we move through this, it's going to be very important for us to use it wisely, and for us to look at reuse options, to look at options to minimize per day usages, to be good stewards of that water, because getting more beyond that is going to be extremely challenging, probably extremely expensive, and come with a lot of hurdles to jump. So I think it's just going to be important for us to collectively use that very wisely.
And I would guess that there's nothing unique about Cabarrus County. All the counties surrounding us, to one degree or the other, are experiencing similar increases in demand as growth occurs.
We are somewhat unique in that we're in the very top of a basin. Rocky River, even though it is classified as a river, it's definitely on the small side as it comes through Cabarrus County as a river. As you get on down towards Norwood and you get on down into Stanley County, it's certainly much more substantial. So we don't have a Catawba River, a Yadkin River, some of these major water supplies coming through our neighborhood, through our county, or directly right next to our county. So we are a little bit challenged. Cottle Creek Reservoir, Lake Fisher, Lake Concord are all have very small watersheds for the size of water body that they are. Thus, why we see them drop so quickly when we get into a dry weather pattern. So we are a little unique from Mecklenburg County, or say Rowan or Iredell or some of the other counties in our area.
And so the issues that we've been dealing with over the past few years in having to restrict development and that sort of thing is pretty much limited not to discharge permits or water supplies, but just actual construction
Correct.
of the physical plant.
Correct. And that's one reason we really took a very, and at the direction of our board, took an approach to try to really, we had a lot of data. And like a lot of people, when you have a lot of data, but you don't really use it because you don't have it in a way that is easy to use. So we were kind of data rich, but it was very difficult for us to use some of our data because we collect when a new subdivision wants to build and they come in. Well, we know about it a couple of years before it's going to be built. Well, then we also collect a system development fee when that building permit's built. So we know, hey, it's getting ready to be built. And then we have flow data that we gather every day, every month, to build our jurisdictions and to track capacity in our system. So we have the past, we have kind of the present, and we have the future data, but we didn't really have it in a way that we could easily use it to predict what's going to happen 3 years, 5 years, 7 years from now. So these dashboards that Black and Veatch put together for us was a way to give us a tool to go in and look and try to figure out, hey, we know this project has been committed to by our jurisdictions and by WASAC. This many building permits has been pulled. Now it's pretty easy for us to say what we think our flows are going to be 3 years from now, 5 years from now, more accurately, so we don't get behind that wave. That we can stay in front of it, but we're also not spending tens and millions of dollars before we need to. That we're properly managing that money. So that's a big goal of those dashboards. And while this process took a little longer than we hoped it would, just because pulling all that together and testing all that out and going through all that took some time, but we're real confident in what we've got going forward. And it's going to be a tool that I think the school systems can use some. To get data of exactly when building permits are pulled. We've worked with them. It's a tool that Concord, Kannapolis, our other jurisdictions can utilize. So we really wanted to put that data that we had in abundance to use.
So how, I mean, we've talked a lot about paper capacity and the issues that that has created, and I know especially with limiting some of the permits, we explained that many times, and I know that we did get some relief from the state on that. How much of that plant is sitting there underutilized right now
So-
because of that paper capacity, which is capacity that we're having to reserve just in case?
All right, so I'm going to give you some numbers, and Thomas is here to correct me, because these, I don't have them in front of me. But at the end of this year, we will be a 30 million gallon a day wastewater treatment plant. We will probably treat around 22 million gallons a day of actual flow we will see at the wastewater treatment plant. And then we have about 2.5 to maybe 2.8 million gallons a day that has been committed to projects that's not yet connected. So that would put us a little under 25 million gallons of what we're either seeing as flow or we have promised, and 30 million gallons of capacity, with the expansion to 34 million gallons well underway. So it is well underway there with that, and that will be online in 2027. So while we're not in a position where we have unbelievable abundance of capacity, we do have capacity. We're in a better position than we've been at any time in the last 3, 4, 5 years.
Yeah, and so are we going to be at a point where we're not going to have to, it's almost like a lottery system now, where the municipalities I know are spending a lot of energy determining who can and who can't and which to approve, and they've got waiting lists and developers that are anxious about their investments in property. Will we be able to work ourselves out of that situation?
Well, I think that'll ultimately be a decision for the Wasatch Board of how that's handled. Currently now, it's our understanding that the jurisdictions like having some control over their portion of the capacity and how that's utilized. So I believe that will most likely stay a situation where each jurisdiction will have that decision to make.
Right.
With their available amount of capacity, how much do they want to open that up? How much of that do they want to if they wanted to go back to a first come, first served, that could be their decision. I don't know that that will be a WASAC-driven decision. I believe that'll be more jurisdictional controlled decision, would be my guess.
And by the way, thank you to Commissioner Shue, who has served as our representative to the WASAC Board for a number of years now, but we appreciate what you do there. And this question may be a little off the path, and it may be out of your area, so you can defer it if you want to. But I know that some of the pending legislation that recently has been discussed regarding an inability to issue sewer permits, that this legislation allows construction of private package treatment plants. Do you have any comments on that?
I don't. I'm actually part of a working committee working on that new bill and that new law. We had a kickoff meeting. That's all we've had, everybody to get to meet each other. But I will be involved with that directly. So we'll be available, hopefully, to have a lot more information in the future.
So that legislation has not even been written yet. That's the purpose of this committee?
Correct. That law created a working group that has until March 15th of next year to bring proposed language, legislation, whatever, back to the House.
We're very pleased to have somebody from Cabarrus County at that table.
Yes.
Thank you for being willing to do that. Other questions or comments, commissioners? Well, thank you very much.
Thank you.
We appreciate you being here. Okay, we move now to discussion items for action, starting with item 5.2 from Finance, Ambulance Receivable Write-Off, and we're happy to have Jim Howden for that item.
Good afternoon, Commissioners. As part of our annual process, we adjust the ambulance accounts receivable balance to reflect what we truly believe is collectible. History tells us that anything older than 4 years should be written off because it's uncollectible. So I'm asking the board tonight to approve the write-off of $1,942,915.92 from our ambulance accounts receivable balance. This does not mean it's not collectible. We will still try to collect this. This is just an accounting entry for us.
And so basically, it stays on the books, but we realize it's probably never gonna come.
Correct.
Yeah. Any questions on this item? All right, I think you have the next one as well, lottery proceeds.
Yes, sir. Lottery proceeds are provided to the county that can be used for school construction renovations and to pay off school debt. In fiscal year 2025, we budgeted $2.3 million from our lottery fund to help pay off previous school debt. And so part of that process is we need to have a budget amendment approved, project ordinance approved, and allow the chairman to sign the application that we send to the state so we can collect those funds. So I'm asking for those items tonight.
Okay, questions on that item? Commissioner Shu, you normally have some comment about lottery proceeds.
Well, I do, and the thought came to my mind there for a long time, you know, when I was first on the commission, we only had like 1.8 million set aside for lottery proceeds. Then, you know, we knew that there was more being held by the state that we didn't get. It was held, that we could get it, but we didn't. So we finally raised that to 2 million. We took 2 million a year. And now we've raised it to 2.3 million. So I'm wondering, can we raise that again? Because are there more surplus laying around there that they're using that we could be using?
I think you're correct. I think when we get to the budget process for fiscal year 2026, there'll be some additional funds there that we could utilize.
Right. I
It's
think we
trending
should.
that way, yes, sir.
Yeah, I think that we should keep abreast of that because they would love to use our money. And we would like to use it too.
Yes.
For different projects that we got. So if we can increase what we can get, we need to do that.
Yes, sir.
Thank you, Jim.
You're welcome.
But there's not a risk of that, just for clarification, there's not risk of that money being used by the state. Now, they may generate interest on it or something, but it's not, it's an account set for Cabarrus County.
Correct, that is correct.
I just want to make sure of it.
Well, since you mentioned that, Chris, it could be, because in times of trouble in the state legislature, when they're trying to get the budget balanced, well, they may decide to hold funds for whatever reason, and it could be lottery funds. They've done that before with fines and forfeitures, and we still hadn't got that money. They owe us tens of millions of dollars for fines and forfeitures, which is supposed to go to the schools. And there at one time, God, it was 200 or 300 million or more. Mike, you might remember, you might know, but it's hundreds of millions of dollars
It's a lot of money.
that the state owes us, and they use that to balance the budget. So we haven't had that problem with the Republican-led legislature, but if that ever changed, it's a good possibility that they would pick lottery funds and use them to balance the budget. But for right now, they're not doing that.
Well, we don't want to risk being in that situation.
No, get it.
Okay, any other questions? All right, thank you, sir.
Thank you.
We move to item 5.4 from Human Resources, compensation market study for general government departments, and we're happy to have Lundy and Associates.
Good evening, Commissioners. My associates are kind of thin today, but Vicki Dross is here with me, and she'll be talking about the work she did in just a second. But I just wanted to kind of kick it off and kind of state that we had 2 projects that we were hoping to accomplish this year. The first was a structure, looking at our entire salary structure and trying to make some adjustments to that. The second project is the one we're actually here to talk to you about tonight, and that is the market study for what we consider our all other departments, basically everybody except public safety and health and human services, which we did last year. So after doing some initial work on the structure project and the approval of the budget, we really just felt like we do not have the funds that are going to be available to do that project this year in a way that would make sense. We don't want to tackle something and cause more issues by creating compression by doing a partial project. So rather than bringing that one forward, we kind of flip-flopped the order, wanted to talk about this third group, and then the game plan would be probably to pass on that project this year, unless there's additional funding that somehow materializes, and then resume next year in the FY26 budget with the market studies for public safety and health and human services again. So that's the game plan. So this is the group that, again, we call it a third, but it's really more positions than that, but less people than that. So while we are getting ready to shift into this, I'm going to pass out just really quickly to all of you a handout that kind of accompanies this, and I'll let Becky go ahead and kind of kick off her presentation.
All right, before we get into the methodology of how this study was conducted and the recommendations that are in the document that Lundy is passing out, I want to just talk for a moment about the condition of the labor market in general. There is a lot of information in the media that when I hear it, I think, well, the labor market is cooling off and things are going to get easier for employers. And I think that is not necessarily an accurate statement when we look at the data that's out there. So just looking at Department of Labor data around openings and hires and things like that, the data that we have goes through the end of July. The Department of Labor has not released the August data yet, but through the end of July, we found that the job openings far exceeded the number of job hires that were made, and the number of hires exceeds the number of employees that separated from positions. And even when we look at those separations, what we find is that the number of people who quit a job, it far exceeds the number of people who are laid off or discharged. So from a true number standpoint, what we're seeing is there are still lots of job opportunities and lots of open positions out there. We do see a lot of information in the media that's around some of the high-profile layoffs. We think about the Googles and the Metas and Amazon, and we see those in the media because they do get so much publicity. And those happen for different reasons. Part of that is some of the tech companies that hired so rapidly through COVID because they were changing the way they worked, and now there might be some layoffs because they don't need those people that they hired, as well as some shifts in using more AI and things like that. So there are additional factors that go into some of those public layoffs, but from a true number standpoint, it is still quite strong. One of the other things that I've seen recently is information that talks about the Department of Labor revising job openings data, and it says that the market and these openings are not as strong as what they initially thought. However, keep in mind that that is new openings, so that's not layoffs, it's not job losses. What we're seeing is there might not be as many new positions created as were initially predicted for this year. We are also coming out of a period where we had 27 consecutive months of unemployment under 4% nationally. That has not happened since the 1960s. So we are still just on the very tail of that incredibly low unemployment track. In North Carolina, it's still under 4% for July. In North Carolina, our unemployment is at 3.7%. So we're still strong here. And if you think about the hiring managers here in the county, and HR can certainly speak to it, it's not that we now have people beating down the door. We're still struggling to attract and retain the best candidates. So I just want to touch on that because I know there's a lot out there that tells a little bit of a different story, and I wanted to share those few data points before we get into the details of this study. We're going to go ahead and dive in and talk about the methodology that we practiced. Again, as Lundy mentioned, we looked at pretty much everybody except for public safety and the health and human services. So this is encompassing 28 different departments within the county. And so what we did is we looked at every position, and we're really looking at those job descriptions. And the reason for that is that titles can be misleading. Here they are fairly straightforward, but certainly there are positions where a title may not tell the whole story. So we're really looking at the jobs based on their responsibilities, the minimum requirements for those roles when we're going to hire. With that data, we then look at several different market sources to get an idea of what's happening. So we do have a Cabarrus County sponsored survey, and I'll share the municipalities that participated in that in the next slide. slide. And we have 3 additional sources. So we use some North Carolina data that's provided by Catapult, and then I use Economic Research Institute, as well as Comp Analyst. So all of these survey sources are based on employer-reported data. So this is not crowdsourced, somebody off the street saying, yep, that's the job I have. These are all based on looking at those job descriptions and matching that data. When I look at the data, I'm looking at the scope, generally looking at the Charlotte metro region, because that is where we are competing for talent, is all across this area. For some positions and for some that are reporting, certainly in the sponsored survey, we are looking at other government entities, but we're also looking at all industries in some of these sources and for some of these positions. Because again, when you think about where you hire people from and where you lose people to, it is not only other counties or cities. So to make sure that we're really looking at what is the going rate for the jobs, we're looking broadly against that scope. Now, when I look at the comp data, if you ever look at comp data, you'll see average, weighted averages, and different percentiles. I use the median or the 50th percentile when pulling in market data for positions, because that is the smack dab in the middle, and it's not going to be skewed by an outlier. So you might have another organization or another county that's paying really high or really low, and if we use an average, it can skew that data. So for that reason, across all of the data sources, we're looking at the 50th percentile or the median. For every position, we're looking across all of those different sources, but not every source has a match. So however many survey sources have a match for the jobs within the county, those are pulled in, they all get equal weight, and they are averaged together. So it is the blending of the medians that give us the going rate for each position. This is the list of different organizations that participated in the sponsored survey. So you can see we've got several different cities, Concord, Kannapolis, and Raleigh. And as far as counties, we've got Johnston, Iredell, New Hanover, Rowan, Union, and Wake. So these are organizations that provided data, again, based on the specific jobs in these departments. Once we have that market data, then what we do is we compare that market average, so that going rate based on the data that we're collecting from these sources, and we're comparing that to the salary structure. And I know, as Lundy mentioned, there's definitely some opportunity to potentially make some structural changes, but for now and following the past practice, we're looking to align that market data, so the going rate, what does it take to get a fully competent employee, and aligning that with the midpoint of the structure. So that follows our past practice, that our midpoint is where we are competitive, and then we have a range around that. So if you're brand new, you're just learning how to spell Cabarrus, you might be on the lower end of that pay range. Whereas if you're, a real rock star, a subject matter expert, you've been here, you're coaching others, then of course you might be on the higher end of the range. So we're looking at aligning market to midpoint, knowing that we have a range around it. So there are many positions that we are recommending reclassification within the existing structure. Now, with the budget constraints, when we're looking at those shifts, it is typically 5% from one grade to the next. So a grade 10 to a grade 11 is a 5% increase. 11 to 12, 5%. That's the structure as it is and as it has been. But because of budget constraints, what we have offered is that instead of doing 5% for every grade, we're using a graduated level, so that those positions that have more grade changes won't necessarily have 5% per grade. So it's graduated there, where for those positions that we are recommending one grade, it would be a 5% one-time market adjustment for employees that hold that position. For employees that are in positions that we are moving 2 grades, we're suggesting a 9% increase. For those that are moving 3 grades, it's 13%, and for positions that are moving 4 grades, it would be an 18% increase. I will also say the majority of recommended reclasses do fall into that 1 or 2 grade. There are just a handful of positions that we would recommend 3 grades to remain competitive with the market, and there's actually 1 position that I would recommend moving 4 grades in order to stay competitive. The overall cost is around $920,000 to make those one-time market adjustments. And that number may, I know with new hires and separations and the time from pulling the initial employee report, there may be slight adjustments there, but it's about $920,000. In addition to the recommendation of making these changes now and doing these one-time adjustments for positions that are reclassed, I would also recommend that you continue your process of looking at internal equity on a regular basis. Do that at least every year. And I know that Lundy and the HR team are already very much doing that. But I think it's important to continue to look at the external data. As I said, I think the market is starting to cool a little bit, but it's certainly not cold. So I think it's important to continue to watch for those labor trends over the next couple of years. And then, of course, any positions where suddenly there's a problem, you're seeing a lot of turnover, or there are positions that are sitting vacant and you're unable to hire, looking at those positions as needed. And then, of course, looking at that structure, whether that's making adjustments year over year or making a total revamp of the structure. All right. Questions? I know that's a lot, but I know most of you are pros here.
And just to reiterate what Becky said, we did have a budget. We knew we had to work within that, and that was factored into decisions, as was the graduated scale. So that's something new that we would explain to our employees. But we felt like it made more sense to try to keep the grades in alignment, even if that meant a little less for employees. We, again, don't want to create additional compression where we have to come back to you and say, we've made these changes and now it's caused other problems. So we are within the funds allocated in the budget with this amount. And, you know, we would love to have brought more positions forward, had to make some hard decisions and had to look at some percentages and, you know, make sure things align. So we welcome your feedback and available for any questions that you have.
Questions for Lundy or Becky?
Lundy, are there many times that you would shift an employee from, say, one grade? Obviously, there's a lot of those. But do you have many that will jump 2 grades or 3 grades or 4 grades? Do you have any idea as to how that would look?
So in this particular project, we had 199 positions that are identified and recommended. And as Becky said, the vast majority are going to be in that 5% 1 grade move. That's really different than what we brought to you a few months ago with public safety. If you recall that, we were very aggressive with that group, and a lot of those positions were moving 3, 4, even some 5 grade shifts. So in this case, I think Becky has the numbers broken down.
Yep, so as I mentioned, there's only 1 position that is being recommended to move those 4 grades. There are 9 positions moving 3, 24 positions moving 2, and 87 moving just 1.
Okay, well, so we're pretty much, other than the new way that we're doing it, pretty much par for the way we've been doing, fairly much. The majority of the increases are just in the 5% level.
Correct. So we felt like this was the fairest way to move it forward and not have to take additional positions out of the increases, but to utilize the budget effectively.
Now, and you had how many particular classifications were there? Did you say was 22, 23?
Well, 28 departments, but
That's what
100
classifications departments.
Yeah, 20, I think it was 28 departments.
But there were some, though, that we didn't look at.
We
Some
looked at
departments.
all, but we opted not to move them based on their relative position in the market. So I didn't provide that list of positions that didn't move.
No, that's fine.
But
I'm just curious, you looked at all of them, but you didn't bring all of them to us with these changes.
Correct. There was a fair number that we said we can hold off on them right now. They are within Becky's formula of where they should be within the market.
But they probably won't miss the next vote, though. Maybe.
Never know, but we felt these were the priorities that we needed to bring forward, and the ones that, again, we pushed the information out to our department heads briefly to give them a chance to look through this, and if they had any additional feedback, we made 1 or 2 tweaks based on what they reported back to us. But we try to look at it from the recruitment standpoint. Where are we struggling to get people in? So our team that's involved in that was part of this process. Becky is definitely looking at the data and guiding us on what is within the realm of market. So we feel like to stay competitive, this is where we'd like to move our positions. And again, this is hopefully the only project I'll be bringing to you on the comp side this year.
But this is already covered pretty much in the budget already, the $918,000.
Mm-hmm. We're funded for this amount.
So we're really staying on track with our standard procedure. It's just that we didn't, the last one, there was a whole lot of adjustments. And this one, we were already in better shape starting out as far as the market comparison.
I think that's fair, but we also decided with public safety to be aggressive. So
Right.
we are staying closer to what the market is with this group, trying to stay even, whereas with public safety, we really pushed to go ahead. And I think a little bit of that maybe even in the human services study, we knew there were a couple of areas we really needed to be more aggressive to stay competitive.
Well, and that makes perfect sense. I think anybody that watches the news or reads the newspaper hears about those employment categories and how much other people are struggling to fill those positions. Yeah. Any other questions? Okay.
All right.
Thank you
Appreciate your
very
time.
much.
Thank you.
Okay, next up, Information Technology Systems, Storage Area Network Refresh, and we're happy to have Todd Shanley for that item.
Good evening. This item is for our storage area network. We refresh this technology every 3 to 4 years. So we started this almost 20 years ago. So it was odd to me when I did look back at it. This is our 7th refresh. The storage area network for us is where all our data sits. So it's the core of our network. So you think about all the spinning disks and things that when WASAC was talking about that data that they get from building inspections and all of that stuff, that's where that lives. So they get that data from us and use that. So it has to be stored on disk. So what we've done here at Cabarrus is we've built 2 data centers. I'll be glad to give you guys a tour. And we've talked about this in the past where I don't like to disclose where those actually are. They are county facilities. We don't lease that. It's not a cloud environment. They're our property. So those live in our facilities, and we got to give you a tour anytime you'd like to take a look at that. But these new systems will be 200 terabytes of storage each. So we replicate the data between the two to keep our critical systems up. So think about the sheriff's data with CAD and RMS. Those things run on that same core. So high availability is important to us to make sure that our services stay online. If you look back at in 2009, when we were asked to partner with the CCS and KCS, we brought them into our data center to save some money, and a lot of money, to do that. And that SAN sits at that core of that partnership as well. So their data from those systems that they keep on their on premises to reside on that same storage area network. So we, as Lindy said, this project is on budget. So we've budgeted the amount to be able to purchase or lease this for 48 months for the next 4 years. And the total price of it is $368,000. And so I guess my ask is that you allow the county manager to sign that contract after the review of the finance director and the county attorney. Happy to answer any questions. I know as soon as I said SAN, Mike was looking at me going, you're going to have to explain what that is. So I hope I did a good enough job for that.
Questions for Todd?
All good?
I think you overwhelmed
Sorry,
everyone.
yeah. There was some other good data there. I'll tell you just a quick anecdote. I was looking at, just haven't been in front of you guys in a while, so I was thinking back about some of when I first came here 28 years ago, we had a mainframe environment. So I looked back to see how big that mainframe was. It was basically under 10 gigabytes. So the terabyte number I gave you a minute ago, there's 1,000 gigabytes in a terabyte. So that was how small our data was when we first came here. The first SAN that we purchased was only 20 terabytes. So in the last 20 years, we've expounded the amount of data that we keep here on storage, on premises. And then for the folks that are listening at home, they'll say, well, why aren't they all in the cloud? I say this over and over again. I'm asked to speak at conferences across the country, and I say this all the time. The cloud is just somebody else's computer. So just be aware that that's not the easy button to just move it into the cloud. There's costs and expense to that too. So that's why we try to keep some of that here on premises, and we're the really smart people. You guys pay a lot of good money to keep it under good control.
All right, thank you, sir.
Absolutely.
Okay, next up, item 5.6 from the Library Board of Trustees bylaws, and we're happy to have Melanie Hollis with us for that item.
Good evening. I just wanted to present to you two changes that Evan included in our Library Board of Trustees bylaws. The first is Article 5, which is a board member ethical standards statement. We did not have that in our older bylaws. The other change is in Article 8 under the meetings. As the order of business, we did have a public comment period, but Evan wrote in a 3-minute public comment period, just so that we could stay consistent with what this board does. We generally don't have a lot of public comments at our Library Board of Trustees, but we just wanted to make sure that we did have a time limit on those public comment periods. So those are the only two changes that we have in this updated bylaws for the library board.
Questions for Melanie? I think I've served on the Library Board of Trustees probably 16 or 17 years prior to being a commissioner and while being a commissioner, and I can only think of one, maybe 2 times that we've had public comments at those meetings, but still a good idea to cover that item.
Just in case.
Have you ever seen a member have a ethical issue all that time? I mean, this portion was added. Has there been an issue with this?
We
or
had
what?
some borderline comments on social media in the last year.
From particular board members?
Yes. But other than that, there
Just
hasn't
curious
been a
why, yeah.
problem. But it's just one of those things at the state level that they recommended, so.
Okay. You answered my question. Thank you.
Okay, any other questions? All right, thank you.
Thank you.
Commissioners, we will have been at it for 2 hours shortly. We've got about 7 more items to consider. Would you like to take a 20-minute break at this point? So let's plan to reconvene at 10 after 6.
I said, oh, there's your 10.
When people get 3 minutes.
Your turns up. You're not red, full board, red. Oh, you did?
I still have a house in Mount Pleasant.
What's that? Where your wife's from?
That's where my dad is from.
Oh, really? I didn't know that. I thought he was from Congress. I mean,
No, everybody thought he was part of the voter for.
Yeah,
His
yeah.
Stanfield.
Okay. Yeah, I thought somewhere down, I thought he was kin to Levon.
Nick, they were all close. But everybody thought he was one of them.
Yeah, I always thought he was kin some way.
No.
He grew up 2 houses down on me. Franklin. move the church up, won't he?
Yes. Okay, I think everybody is back from that break. We're going to make one slight change in the agenda and move item 5.12, property switch with Rocky Ridge United Methodist Church, up to be next. So I think Kelly Sifford, and she's the one that we didn't bring back with us. Kelly, you're up on the church property switch. Sorry about that.
She probably want me to get involved in it too.
Okay.
Thank you. So we have been working with Rocky Ridge United Methodist as well as the state on a property exchange plan. Lauren, can you bring up that map? We've been looking for a second entrance into Franklin Park because we do have the railroad going across it, and we are anticipating with Red Bull opening that will be in use more than it is today. So that is the only entrance exit to the park. So what we would like to do, and this is the survey of the area and it's been recorded. The state has given us an additional triangle, so there's two, like a big triangle there, and then there's a smaller rectangle up on Stonecrest. So the plan would be to exchange the triangle property for the rectangle on Stonecrest. You will see there is some difference in size for those, but the property adjacent to Stonecrest is worth more because currently it is plotted for cemetery plots. So it has more value than the vacant land that's behind it. So the two are about equal value due to the size. So that would give us the ability to exchange that with the church, and we do have church representatives here. But that is what the survey you see in front of you, and that is the request to to do the property exchange with them in order to get that second entrance to the park, and that does attach to the property, the back side of the property that we could get to there's an old logging road that goes in that way, or an old road related to the farm that was there that would be a good bed for a new road into the park.
Yeah, it's a little bit tough to see on that. Excuse me. That southern triangle, that's the area that the state just transferred to the county. That wasn't part of our original Stonewall Jackson transfer. So they added that in to facilitate this trade. So the southern triangle is the one that the state just gave us, and we just recorded the deed. The triangle kind of in the middle there, that's what we already owned. So if you put those two together, that's what the church would get. And that's just, that isn't on any road, it's just some land that's between their sanctuary and what we have. And then it's actually kind of a trapezoid up there, where you can see the road come down. That's what we're getting in trade. Yeah, that one.
This is the cemetery
Yeah,
here,
yeah,
and the church is up here.
yeah. So,
This is the road frontage.
So that opens up that entire corner there. I mean, because we
Yes.
own the property on two sides
Yeah.
of it.
And I understand that they are requesting in the future when we do develop that they would like a berm along the cemetery, which we would probably be required to do anyway. But
Yes, we would like some kind of berm to kind of protect the cemetery property. We're giving up 63 sites there for this swap. It just makes sense to do it when you guys need it. We don't really need it. We're probably at 100-year capacity on our cemetery, so, we'll let somebody 100 years from now worry about this. So, if we can get the berms put up there, it'll really make everything better. And then we're gonna have to cut a road in there because we won't be able to have access to it for a funeral. So now we've got the expense of cutting the road back on the left side to come in from the lower side of the cemetery. So it's just, I think it'll work, but we do need you guys to step up and do, make it beautified down there. There's a fence that goes all the way down past on the property that you're taking. That fence needs to be stopped at the point and turned and goes straight down the property line, the new property line. Other than that, we're good to go.
Are all those things included in our agreement so that?
This is just the property exchange. We will have to work out, I mean, it's going to probably be a while before we develop that entrance anyway, realistically. I think the fence is probably the thing that we need to look at most urgently, and we can do that. We have not done that yet.
I guess my question is, do we need to get all those things written into an agreement before we would vote to approve it at our regular meeting?
I mean, we can.
I think that may make sense to protect.
Okay.
I think it would make sense for
Okay.
us.
Yeah.
I mean, we've had like 3 or 4 people involved from you guys. I think one guy came back from retirement. There's been a couple of people, and when we said, let's do that, no problems, can you do, we've been very amicable to make this happen. It works great for us. We're happy to do it. We'll gain a little bit of property, but it's real property we probably never ever use. It just ties in with our other property.
Well, we're gonna do a resolution for your regular meeting, so you'll have that. But we can go ahead and do it, a simple agreement that includes the berm and the fence, as the pastor just talked about, so.
Yeah, and I think probably when, the question, I don't know if this will be on consent or if it's on our regular agenda, either one, but the question probably will be asked, has the church looked at this and are they good with it? Probably.
Well,
We'll get it to them and
I don't know, that they probably have to do a resolution on their own end, in terms of documenting it, with their board, but.
Yeah, we have the board approval to do what needs to be done. So whatever we come up with, any kind of agreement we come up with. And I do have another question. We have a road that goes to our cemetery.
If you could come up, these meetings are broadcast and the people online can't hear you. Sorry about that.
We have a road that comes from our church that goes by, we just built some brand-new columbariums for burials. So we have a road that comes all the way that goes to Jackson Terrace. The
Right.
road that you're gonna be making wider. Are we gonna be able to leave that road open? It's not a state-maintained road, and it's not 2 cars can't pass it at the same time, one has to pull over. So is that gonna be a problem going on to Jackson Terrace? There's a lot of questions that we have on what we can and can't do. Yeah, right there in the circle. From the backside, that'd be great too,
Yeah.
with a gate, because if not, we're gonna get a tremendous amount of traffic coming through the church parking lot.
Right.
Because when school's out there at Jay and Freeze, traffic is terrible on Old Charlotte Road. And the people are waiting, and we have it now, they cut through and go by the cemetery and go through the church parking lot.
Then we would need to push our gate back past that intersection there with your road, right?
Yeah.
So that.
And we would only use the road for funerals, We wouldn't need it any other time. We'll probably stop the other road, we'll just cut it off. But we do need some kind of access to get in for the funerals. Because now when we have the funerals, the cars can come down the road, turn on Jackson Terrace and park on Jackson Terrace. It takes up half of Jackson Terrace because there's no traffic on Jackson Terrace.
Right.
But there will be with this new expansion.
Yeah. Yeah, I think So from my perspective, just as long as we have enough in writing so that the church feels comfortable that their needs are protected,
So maybe we can change the agenda item to say, authorize the county manager to execute the documents, and that way we can get agreement on the documents and,
I think that works.
And there will be like I said, a resolution on our end.
yes.
I'd like to get a copy of yours.
Okay.
For the church.
Okay,
Just so we'll have it in our file.
okay, no problem.
I think
Okay.
another thing I want everybody to realize too, just from the church perspective, that it'll be a while before we would develop an entrance into this, so.
Okay.
I just don't want folks to think, in the next 6 months, we're gonna be putting an entrance through there.
No.
But yeah, I think all of that should be in writing as far as,
Yeah, we assume
to
it's gonna be
safeguard for the
a
church,
while.
but, yeah.
Because we've been trying to buy that little piece of property from the state for probably 40 years.
Right.
It's always a problem.
Right.
All we want to do is tie up make our lines a little more clear, for nothing, but just to tie it up, because you can see how it zigzags in.
I just wanted to say thank you to the church for being willing to work with us, because this will also help us out massively.
Yeah.
So, thank you to you and your members
Well.
for being welcoming for that.
Yeah.
Absolutely.
And the people who came and presented it to us were very, they were very nice about the whole procedure. We want to do everything we can to help. We're not trying to, take away from you. We want to, make it work for everybody. And so far it has. Every Friday, starting October the 3rd or whatever that first Friday is. Tim's a regular.
And hopefully, we're going to cause something very positive to happen next door to you that's going to benefit the church as well.
We think the same thing.
We're-
We really do think the same thing.
We appreciate you being here, and sorry you had to wait so long.
No, that's
down-
okay.
down.
Hey, I learned a lot about the water and sewer of Cabarrus County. More than I ever want to know, let me tell you.
Thank you.
Thank you.
So much.
Okay, I'll get with you.
Okay, next item is 5.7, and that is regarding the animal ordinance. And I'll turn the floor over to Attorney Cook to talk about that item.
All right. Well, there's a brief summary in the agenda. We really didn't have a formal committee. It was kind of an ad hoc, a group of people that got together. It was actually the sheriff and his animal control department, the guys who actually are out enforcing the ordinance. It was, the chair was involved, the county manager, and Evan, and me. And so, basically, what we were trying to do was we were getting some complaints in different places to the sheriff, I think to the Board of Commissioners, you may have gotten some, and to staff at the county. And we were trying to evaluate those complaints and see what could be done to the ordinance to maybe strengthen it, maybe streamline it. And so that's how it got started. We basically looked at ordinances from a number of different local governments concerning particularly dogs. This really was driven by some complaints about dogs, not about other kinds of animals. But they're all included in the same chapter of our code of ordinances. So we looked at all those, and basically, the state statutes that give local control of animals are pretty broad. So these ordinances are all over the place. So we tried to pull some of the best things out of some of those to put in ours. But most of the changes, and I'll go over just the main ones in just a minute, were driven by what the sheriff felt like he needed in terms of control and enforcement, and what he thought would make it easier for them to administer the ordinance. So that's basically how that came together. So what I asked Lauren to do was include in the agenda the actual clean copy of chapter 10. And then also what in your copy came out to be black, so it's a black line of the changes. So basically, that's where we started out. And one of the changes was that we had a situation up in Kannapolis where a pack of dogs had attacked some delivery people on this property. I think 3 different occasions. So we changed it so animal and dog also includes the plural of those words, so that if you have a pack, you still can do something about it. So if you think about it, if you have, and this is what happened up there, maybe 6 dogs attacked these people. You don't know which dog, if you're just talking about one, you don't know which one it was. So that was one of the changes that went into the definition section. So basically, if you start on page 83, that's the start of the black line copy. So you can kind of see what was changed. And really, the main thing that was changed is we combined dangerous animals and vicious dogs. The procedure for dealing with those basically were combined into a couple of ordinance sections. And actually, that's the part that starts in your packet on page 86, and goes over to 87 and 88. So basically, we just combined that. That was probably the biggest change. And of course, you have to have due process for the dog or animal owner, and for the dog itself, to make sure that we're not just taking people's dogs or doing things where they don't have an opportunity to either appeal or to present their side of the case. So basically, there's a lot of due process that's put into that procedure. So that's probably the biggest change. We also added a section that this was a suggestion from one of the people who we'd been working with, that was a property owner up in Kannapolis, that if a dog or some other animal creates some problem for a person, injures them, or if the dog gets injured, that the people that are on the hand have to render first aid to the dog or to the injured person. That was not in our ordinance. And there was also another provision in there that said that they have to report it to the sheriff's office, so that they find out about it if there's actually someone who is injured as a result of some attack. And so that's another change that was put in the ordinance. So
Can you explain
turn
that?
over to, say, page 86, where it talks about restraint of dogs and other animals, you can see that's probably the place where people intersect with enforcement, is if they're not restraining the dog. You have to either have someone right there with the dog, or you have to have it on a leash or some other type of restraint. The sheriff wanted to add under offenses, a number of offenses, to make it that it was the 4th and subsequent offense where the animal would automatically be seized. Before that, the sheriff could seize the animal, because the circumstances of the situation might require that, but the person can still, under the procedure, get their dog back. And I'm using dogs because that's the most common situation we were dealing with. So that's all spelled out in those sections of the ordinance.
Hey, Rich,
Yes.
back up to that first aid part. So it now says that they are required to render first aid. Right, that's what you're saying?
Yes.
What if, number one, what if they don't know how to do that? And number two, if their dog just viciously attacks somebody, and now we're gonna send them over to the person who the dog attacked? We don't think that's gonna cause any problems? You just got bit by their dog and now they're, are we putting somebody in a bad spot with that?
Well, I suppose it could have happened that way. I was thinking when we were doing that about the situation in Annapolis that we were dealing with, which was a situation where I say where there had been 3 different attacks, and these were different people who come on the property to deliver packages. One of them was a guy who was doing the pest inspection on the property, and that last one, that poor fellow was pretty much chewed up by these dogs. If you saw the pictures of his injuries, it's just, it was pretty bad.
Yeah, I think the way it reads is maybe rendering aid rather than giving.
Yeah.
But, so that means call an ambulance. And then in that case, I think that's what was needed.
Yeah, that's in section 10.3.
Yeah, your page numbers don't match our page
Well,
numbers on the screen.
I'm looking at down here.
I think the page that you just talked about restraint and ours is page 123.
It's 10.3.
10.3,
It's on
page
3,
122.
3 of 17.
Yeah, those are the pages of the ordinance. The pages of the agenda are different.
So it reads that they shall render first aid, not offer assistance. Or whenever I read that, if I was in that situation, I feel like I'm gonna have to go physically touch that person or, try to, I don't know.
We
It
can-
seems like an odd.
We can tweak that, or we could add shall reasonably, we can put a reasonableness standard in there which addresses, I think, both your concerns.
If the person can't, or if the person doesn't really need, say they got
Right.
bit, but not really need
Right.
first aid, then are you gonna be able to go after that person for not immediately rendering first aid? Would they be able to then go after them?
That particular provision of the ordinance is not a misdemeanor, so there's probably no legal requirement, no legal consequence, I should say, to that. It was basically just to kind of try to recognize that if you have an incident where someone has gotten, been injured, that something needs to be done by someone, not just leave the person out there.
It was also to add that duty to report, because that was not in there before. And so if somebody called, it was complaint driven. And this way it will be, ideally, if somebody has had an injury and then had to seek some sort of medical treatment for that, it will then have to be reported. Whereas before, if the person sought treatment and didn't want to report it, it didn't get reported.
I think the sheriff wanted to know if we've got a problem out there, with people being injured by dogs. So that's why that provision was added. So that really is pretty much all of the big changes that were made. It's a long chapter of the ordinance, but a lot of it stayed the same. So we're just trying to do what we could to update it in terms of what we were seeing or what the sheriff was seeing in the way of of situations.
So which, which section deals with the changing the plural from
That's back-
animal to
That's
animals?
back in the definitions.
10.2.
10.2.
It's the last sentence of it.
Okay.
If you look at, if you're looking at the ordinance pages, which are the ones in the center at the bottom, it'd be on page 3.
Page 3.
You know, about a third of the way down.
Yeah, top of 122.
Yeah. See where it says any reference? Right there.
number
yeah.
Above them,
Number one.
not just singular of such, but also more than one of such, including a pack of such that engage in concerted efforts. Yeah, because I see the singular still up there, but
Yeah.
that covers that.
Yeah, that was to save having to change all those places.
Yeah, I think the question, the situation that he referred to was these same pack of dogs had, I think there were 3 reported attacks. So
Yes.
they were down to number 4, that was mandatory seizure. Yeah, it says automatic seizure of the dog.
Yeah.
And
Well, 4
they were
times.
saying they couldn't do it because they didn't know which dog.
Right. Yeah, I think that, I mean, I'm fine with it. You know, as Rich said, he consulted with the sheriff, and if the changes he wants to see made, I think it's great. I
Sounds
think
like
4 times is a little lenient, honestly. You know, it could, I mean, that, but you know,
I think the
I
other.
mean, 4 opportunities to attack someone is,
Well, the situation in Kannapolis, without getting into too many of the details, is kind of an unusual deal. If, the property is a kind of a mill-sized house, you know, in Kannapolis, with a small front yard between the front door and the street. And actually, they've got, they had a, kind of a, it was almost a makeshift fence. It wasn't an electric fence, but kind of a fence that wouldn't stand up to much, that went around the perimeter of the front yard. And they had actually a box outside of the gate where that fence was at the sidewalk going into the house. And that box was for people to leave packages and not come up onto the property. And it was marked that way. So there were some things that the property owner tried to do to try to deal with this, but they've got, there were 6 dogs I think they have, and they all are, like I say, they act like a pack. And the sheriff, the sheriff's office, when they were dealing with that situation, you know, made a couple of suggestions, but they didn't have any information as to which dog it was. They just knew there were 6 of them. And so they made a couple of recommendations, which the property owner followed, to try to deal with that situation, along with, you know, all what had already been done. So it was one of those situations where, you know, there was probably some equity on both sides, you know, both from the property and the dog owner, and also, you know, particularly the Terminex guy who would come onto the property, you know, to do some pest control. You know, I mean, I assume he was invited, excuse me, onto the property, you know, by the property owner, but the dogs got after him. And he was a big man. You know, he's like 6'4", weighed about 250, and they got him down. And I mean, he had bites all over his body, and places where it torn the flesh. So, I mean, it's a pretty bad situation. But, you know, again, you know, these state changes won't completely address that situation. Now, if it occurs in the future, this ordinance will better address something like that if it were to happen again. But we can't go back and undo what was done previously, you know, by the sheriff's department with reference to those past incidents. So, and then there's another situation where this is one where the guy who lives in I forget which neighborhood, he complains about the dog next door, but the dog is restrained within an electric fence and never leaves its property. But whenever somebody walks by on the sidewalk, the dog, you know, comes out of the house or you know, gets up out of the front yard and runs to the end of it. And of course, it's kind of scary, I guess, particularly to kids, you know. But as long as the dog stays on his property and doesn't, you know, and there's no contact and nothing happens, you know, it really isn't much the sheriff can do. So they've addressed these situations, all these complaints that we talked about, that we reviewed with reference to this ordinance. But,
So now what happens if a dog comes outside of that electric fence? Is this giving more teeth for the
Yep,
sheriff's
it
department
does.
or animal control?
because it would come under the restraint section of the ordinance.
Okay.
You would have broken restraint, so there'd be a violation. So you were trying to balance, you know, between dog owner and dog and you know, people who were just happen to be going by on the sidewalk or, you know, or may have some other reason to be on the property.
Yeah, I think if the dog should break through the electric fence, then it goes down to these
Yes.
offenses
Yeah,
listed down below. So it doesn't, does it have to attack somebody in order to fall in that category?
Well, not necessarily, but, you know, that's kind of broad. It's, you know, it's so the sheriff can deal with the situation based on the facts of that situation. Gives them a little bit of discretion to be able to deal with it. So you see where it says they can seize the animal off the first fence. That probably would not happen.
Well, yeah, it says unless they comply with A and B, which is
Right.
talking about the premises. And of course, on a 5-acre tract, they don't have to do anything.
That's right.
Is Sheriff Shaw's happy with this?
Yes. Yes, he was very involved with,
You know, we can set all the ordinances and make all kind of rules and all of that, but when it comes down to it, the basic thing is pet owner responsibility. You know, with owning pets, dogs, there comes responsibility. And until people that's got these animals accept that responsibility, then you're gonna always have these type issues. So my only suggestion is these are guidelines, ordinances for people to go by, but still yet, if you don't accept the responsibility for your pet, you know, then we're not making any headway at all. You know, the sheriff can enforce whatever, you know, we set aside as an ordinance or a guideline, but the ultimate responsibility falls on the pet owner.
Okay, any other questions or concerns on this item? If not, then this will I think is included on our consent agenda for the regular meeting. Okay, so we will move to the next item, 5.8, from Planning Community Development Budget Amendment. Robert Anderson.
Good evening, Commissioners. We recently received our contracts for some of our grants through the Community Development Department. The budget amendment before you all just reflects the funding that we received in those grants. Pretty straightforward, hopefully pretty simple for y'all.
Okay, any questions for Robert? Okay, thank you, sir.
Thank you.
Okay, we move to 5.9 from Tax Administration, 2014 write-off. David Thrift.
Good evening, Commissioners. So as you know, the Tax Collections Office uses all available resources, due diligence, and all statutory remedies that authorize us to collect taxes on both real property and personal property. However, North Carolina General Statute 105-378, which is titled "The Use of Remedies Barred," prevents the tax collector from exercising any new enforcement to collect on tax bills that are 10 years old from the date that they first became due. So 2014 taxes first became due September 1st of 2014. They're now 10 years old. Because we cannot initiate any new enforced collections on these, we ask this board to allow us to write off those balances from an accounting standpoint. So our request tonight is a motion to approve the write-off of real and personal outstanding taxes from 2014 totaling $114,300.60. And that list is also in your information. I'm happy to answer any questions.
Questions for David? I think it's pretty amazing that the tax write-off is so much less than the ambulance fee write-off by like 20 times.
Are these?
Thank you.
Are these? Yeah, good job. Are these tax write-offs? Are they people that moved out of? Some of them are businesses, obviously, that probably have gone out. But are these people who've passed away? They've moved out because, or are these people that just don't pay their taxes because they're too high?
Typically on the ones that are real estate related, it's a difficulty with recognizing who the current owner is and who's responsible. Those properties that have a person is deceased and has heirs and that's passed to their heirs, and it's difficult to collect in those situations. Either that or there's situations which we don't know who the owner of some small pieces of property are that have some value and have some taxability. A lot of the personal property is businesses that are no longer in business or out of state, and we have no actual reasonable mean to collect on those taxes. But there's a number of reasons, a number of variables that could be in place there.
Okay, any other questions on that item? All right, thank you, sir.
Thank you.
Okay, next from Transportation, fiscal year 26, 5311 Community Transportation Grant. We're happy to have Charles Ratliff with us for that item.
Good evening, everyone. Thank you for your time. What I have for you is the 5311 Community Transportation Grant for fiscal year 26. It's in two parts, administrative and capital bus replacement. Both portions are predetermined by the state. So for the administration portion, it's $194,578 with a 15% local match, which is $29,188. The capital part, it was determined by the state that we have two buses eligible for replacement. That's based on current mileage. That is $250,000 with a 10% local match for a total of $25,000. Altogether, the grant will be $444,578, and the county's part would be $54,188. I ask you to accept that grant and hold a public hearing. It is required for a public hearing.
Okay, questions on that item? All right, thank you, sir.
Thank you.
Okay, we move to item 5.13, temporary construction and permanent easement. Kelly Sifford is back for that one. Let's see, I skipped over 5.11. Sorry about that. Appointments to boards and committees. And you all have a copy of that you received by email as well as in the agenda. Does anybody have anything there to discuss? All right, thank you. You're on, Kelly.
Thank you. This proposed easement, temporary construction and permanent easement is located on the property at A.L. Brown High School. It is for a bus stop. I think there's currently maybe a sign there, but not much else. They want to install a proper bus stop. However, the school, Kannapolis City Schools, has requested no shelter with this one because they just invested in a very nice sign that's directly behind it and do not want the sign blocked. So we're asking them to do a concrete pad and a sign on this one. They are offering us a whopping $105 for that, those easements. And so, again, with this one, I'm waiting on getting proper documentation. The documentation in here says that they have, it mentions the shelter. I'm asking them to get ones that do not say shelter. So looking for, again, approval with the county manager able to execute the documents for this one, and I can make sure we get the right documents before we get it agreed upon.
Okay, so the county has title to that property?
Currently, yes.
Yeah.
I guess we have some outstanding debt on
Right.
that one. I did not realize that either.
Yeah. And so I don't know, of course, it's a very small amount, but with all the discussion that we have about funding for public transportation and trying to create more opportunities for public transportation, I feel a little guilty taking the $105.
Well, and
But-
we can waive that. They did ask me initially, and I did not realize it was $105, and I was like, yeah, we want to be paid, but if you would like to waive that, we can waive that. I guess you still have to do the dollar, right, Rich?
Well, no, not necessarily.
Not necessarily, so we could waive it. If you wish to waive it, we can waive it.
It's like one government agency paying the other, swapping money back and forth.
Yes.
Um,
So,
Commissioners, you have any thoughts on that?
okay.
I agree to waiving it.
We will adjust the agenda item then to say no money. And
Could we also find out what we still have financing for on that property? What we still have financing for on that?
I will see if I
I'd
can,
be interested to know.
To the school site?
it's A.L. Brown.
Yeah.
With that newest edition, the STEM edition was what? I'm trying to remember exactly. It's been
It's-
about 7
So
years
it's
ago?
likely
Okay, so it's
that.
probably that.
It's probably
Yeah.
that.
I can
of
research it, but I,
Yeah.
Just out of curiosity.
Okay, is everybody good with that? Okay, then that completes our discussion items, and we move to approval of the regular meeting agenda. I don't think we changed anything that impacts that. Seems like there might have been one item.
No.
I don't think the youth commission is.
I think we have to have the public hearing for that transportation grant. That's all. Yeah, I think that's the only, that number 19, its own consent for.
Right, and so that would have to go to new business and public hearing. So, if there's nothing else, I would entertain a motion to approve the regular meeting as presented, moving F19 to G1 and setting a public hearing on the 5311 Community Transportation Grant. Okay, we have a motion and a second. Any discussion?
Second. Chris, you made it.
Tim seconded it. Yeah. Any discussion? All in favor, please say aye. All opposed, no. That motion passes. We do have need of a closed session tonight. So at this time, I would entertain a motion to go into closed session as authorized by North Carolina General Statute 143-318.11A and 3. Okay, we have a motion and a second. Any discussion? All in favor, please say aye. All opposed, no. We are now in closed session, and thank you for everyone that joined us in person and online tonight.